Good afternoon. I'm Dr. Robin Luke, the chair of the ACP Board of Regents. We're here today to introduce to you ACP's new paper, National Immigration Policy and Access to Health Care. As you can tell from my Scottish accent, I myself am an immigrant to the United States and a proud citizen of this great country. I am fortunate to have excellent access to health care. But for many immigrants, both documented and undocumented, this is not the case. Immigrants are much less likely than U.S. citizens to have health insurance. As ACP has previously documented in our paper, no health insurance, it's enough to make you sick. Those who lack access to health insurance both live sicker and die younger. This is especially true of the Latino population, the fastest growing ethnic group in the United States. The primary driver behind immigration is economic opportunity, and the U.S. demand for workers brings immigrants to our country. However, despite coming here for increased economic opportunity, immigrants tend to be employed in especially undocumented immigrants, tend to be employed in low-wage labor or service jobs that do not offer health insurance. Immigrants are also likely to lack the funds necessary to pay for health care services without insurance. Undocumented immigrants have particular challenges in navigating their undocumented status. They may fear that seeking medical attention for health issues could lead to their being reported to authorities and eventually deported. And I have personal experience as a physician of that phenomenon, where I felt that the patient was scared to tell me her real history in case I became someone who would report to the authorities. So they fear seeking medical attention for health issues, and that would lead to them being reported to the authorities and eventually deported. Delaying care in this situation could lead to increased pain and suffering if they allow things to progress until they're acutely ill. Delaying care may ultimately place a greater resource of burden on the health system, especially if the care is provided in an emergency room. Yet the United States has responsibility to protect its borders, and people who are not here legally cannot reasonably be expected to have the access to publicly funded benefits available to legal residents and U.S. citizens. This is a complex and often emotional issue, yet avoiding the issue is not the answer, nor is having states enact a patchwork of individual responses. With the immigrant population in the U.S. continuing to grow, this is a national issue requiring a national policy. The fact is that immigration will place pressure on an already inadequate system. Something needs to be done before the unsustainable current system is thrown into crisis. Pardon me. We hope that by releasing this paper now, we can help influence the discussion surrounding immigration policy and immigrant health care. Today, we present evidence-based recommendations on designing a national immigration policy on health care that balances the countervailing needs of individuals and society and is also in accord with the standards of medical ethics and professionalism. What is to be done? To answer that question, I'm going to turn things over to my colleague, Dr. Ralston.
Hi, I'm Dr. Fred Ralston, president of the ACP. Dr. Luke just outlined for you some of the challenges that immigrants face in seeking health care and some of the reasons they don't have adequate access. The paper we're releasing today details a call to action for the development of national immigration policy on health care. As Dr. Luke noted, we call for a national policy because this is a national issue. The current patchwork of state and local policies is inadequate. Enacting immigration laws on the state level results in unnecessary confusion for people seeking health care services. Researchers have estimated that the U.S. population will increase by 80 million over the next 50 years by direct or indirect consequences of immigration. We agree that it will be daunting to craft a policy so all of our country's competing needs are addressed. But we can start by acknowledging the different and sometimes conflicting issues involved. Number one, we, just as any country would, need to have control over who we admit within our borders, and we need to be able to enact and implement laws designed to reduce unlawful entry. Two, we need to be able to differentiate our treatment of people who are in complete compliance with our laws for establishing legal residency and those who are not in determining who has access to subsidized health care. Three, we need to take into account the concern that undocumented immigrants in some cases may not pay taxes but could potentially receive care that is subsidized by legal residents lawfully paying taxes. Four, we need to recognize that residents who lack legal documentation are likely to access health care services when ill, especially in emergency situations, and that hospitals and physicians are legally and ethically responsible to care for them. Number five, we need to recognize that society has a public health interest in ensuring that all residents have access to health care, particularly for communicable disease. Delayed treatment for communicable or even non-communicable diseases may be costly and may endanger the rest of the population. Six, we need to recognize that people who delay care because they cannot obtain legal residency are likely to generate higher health care costs when they do seek health care, and these costs are ultimately passed on to legal residents and taxpayers through higher premiums and higher taxes. And last, we need to recognize that any policy that is intended to force millions of persons who now reside unlawfully in the U.S. to return to their countries of origin through mass arrest, detention, and deportation could result in severe health care consequences for affected persons and their family members, create a public health emergency, result in enormous costs to the health care system of treating such persons, including the costs associated with correctional health care during periods of detention, and it's likely to lead to racial and ethnic profiling and discrimination. The United States must be able to enforce its laws, including the option of returning undocumented persons to their countries of origin if they're found through legal process to lack legal residency status, but a policy of mass detention and deportation of tens of millions of persons would likely not be practical and would create an unprecedented health care challenge. It's a daunting but important list. Creating this policy is an absolutely necessary task, but one that needs to be handled carefully. Our position paper provides detailed recommendations for improving access to care, delivery of care, and eliminating discrimination in health care and professionalism. Our proposals for a national immigration policy on access to health care include the following key elements. Immigration policy shouldn't interfere with the ethical obligation of physicians and other healthcare professionals to care for the sick, and shouldn't foster discrimination against a class or category of patients in the provision of health care. It would cause a breach of medical ethics to require that a physician report a person's immigration status to government authorities. Access to health care should not be restricted based on immigration status, and people should not be prevented from paying out of pocket for health insurance coverage. This should include the ability to purchase coverage on their own at their own expense from the state health exchanges that will be created under the Affordable Care Act. Taxpayers should not be expected, though, to subsidize health insurance coverage for persons who aren't legal residents. U.S.-born children of parents who lack legal residency should have the same access to health coverage and government-subsidized health care as any other U.S. citizen. National immigration policy should recognize the public health risks associated with undocumented persons not receiving medical care. Policies are needed to increase immigrants' access to comprehensive primary care, prenatal care, injury prevention initiatives, toxic exposure prevention, and chronic disease management. Such policies would make better use of the public health dollar by improving the health status of the immigrant population and alleviating the need for costly emergency care. All residents should be able to obtain clinically effective vaccinations and screening for prevalent infectious diseases. And all patients should have access to appropriate outpatient care, inpatient care, and emergency services. And the primary care workforce should be strengthened to meet the nation's health care needs. I'd like to leave you with an example of why this type of policy should be important to us all. Take the case of immigrants with tuberculosis. Under the current system, they may be afraid that going to a hospital to seek treatment would place them at risk for deportation. If they decide to delay care because of this fear, it could increase the number of people exposed to the disease exponentially. Imagine if those same immigrants were not only unafraid to visit the hospital, but they were receiving regular preventative primary care services. It's in the public interest to ensure that such persons are treated before experiencing symptoms and before the public is exposed to infection. Immigration policy is complex, and ACP recommendations assuredly do not attempt to solve the broader debate on immigration policy. Instead, we focus only on the health consequence for immigrants and non-immigrants alike of the country's failure to establish a national policy on immigrants' access to health care that's in accord with our values and physicians' ethical obligations to care for the sick and disabled without discriminating against any class of person.